Good afternoon. I want to thank everybody for being here on what has turned out to be an exciting day for us here in Cumberland County. I think there are some who are standing up here with me that's been a long time coming, and that's not untrue. However, our goal in this situation was to try to roll this project out as much as we could all at once in order to have a maximum impact. Over the last year, I served as president of the Pennsylvania District Attorneys Association, and one of the things I did during that year was a series of roundtable meetings around the Commonwealth of Pennsylvania. As many of you know, I have some experience traveling around the Commonwealth of Pennsylvania, but this was a much more pleasant trip to go and meet with my colleagues in small groups in 9 locations around the state. And to hear essentially what was going on in their areas, what our association could do for them and what they could do for us. But one of the things we wanted to find out was what are really the issues that are facing prosecutors in law enforcement and government in areas large and small throughout the Commonwealth. And it became evident early on in that journey that the #1 issue facing certainly law enforcement in the Commonwealth of Pennsylvania is the abuse of prescription drugs and its partner abuse of heroin. Heroin is readily available these days. It's more pure than it's ever been historically, and it is killing people at a rate that has never been seen in this Commonwealth. What we're confronted with as government officials is an unprecedented combination of a public health problem and a crime problem. And a problem of that nature demands solutions that go to the public health nature of it and also go to the criminal nature of it. On the criminal side, my law enforcement colleagues are here. We've done a tremendous job in Cumberland County in taking drugs off the streets, heroin in particular. Overdose deaths and overdoses are a little bit down as we stand here today compared to a similar time period last year and the 6 months before. A lot of that has to do with heroin that we've taken off the street. But there's no time for us to celebrate because looking at the complaints that come through the booking center, it's starting to come back into the community in very significant amounts. So we've got the law enforcement solution in place. There are certainly things that we can do in terms of law enforcement to target the problem, and we've done that. But there are also important public health responses for us to do that can have an immediate impact on combating this problem. And one of the most important things that can be done is to provide an opportunity for people to get rid of their unused, unwanted prescription drugs. We were having a conversation before most of the people showed up here today about the age of prescription drugs that we have in our homes. And, you know, my oldest child is 13, and I know that we have some prescription medication that was prescribed to my wife when he was born 13 years ago in the house because really you don't want to throw it away, you don't want to flush it. And I can tell you from my perspective as district attorney, what people are looking for, especially now when they commit house burglaries, is they want to go in your medicine cabinet or your kitchen cabinet and they want to find those drugs. You know, they want money and they want drugs. This program, the MedReturn program, funded by the Pennsylvania Commission on Crime and Delinquency in cooperation with the Department of Drug and Alcohol Programs. In the western part of the state, there's a foundation that gave some money towards this effort. Pennsylvania American Water Company has also donated some boxes towards this effort. This is an effort to directly combat this issue by getting the drugs off the streets and having them disposed of in a safe manner. There are some other public health responses. One is a robust prescription drug monitoring program. There's a bill pending in the legislature right now. I'm proud to say it's sponsored by our state senator from Cumberland County, Senator Vance. That bill passed the Senate overwhelmingly, and we're waiting for action on it in the House. So our response has been, as I said, a criminal justice response and a public health response. I'm pleased today here to be joined by numerous of my colleagues in law enforcement. The response to our request for people to house these MedReturn boxes has been overwhelming. You can see there are 18 boxes up here. They will join 2 boxes, I'm sorry, already in place in the county, so that we will have 20 med return boxes throughout the county. All of the locations will participate in our collection and disposal program. We have police chiefs represented from across the county, Chief Spots from Mechanicsburg, Lieutenant Green from East Penn, Chief Hockenberry from Camp Hill, Chief Finke from Newville, Chief Scott from Shippensburg, Chief Wrights from North Middleton Township, Chief Adams from Upper Allen Township. I'm also particularly pleased to have with us today all 3 Cumberland County Commissioners. And without their support, we couldn't do any of the work that we do. And they've certainly been supportive of this program to the extent that we intend to place 3 of these boxes in county buildings. And I don't know anywhere in the Commonwealth where that opportunity has been afforded to this program. So I'm very proud to say that Cumberland County is going to place 3 boxes into county buildings. We're also excited that there's a box going into Dickinson College and one going to Shippensburg University. Very excited about that. We're also joined by some partners up here, I'm saving the best for last, that guy standing over there. But our director of the Cumberland County Drug and Alcohol Commission, Jack Carroll, who is a guy who is a valued colleague to everybody in the county. And you might not think that the director of the Drug and Alcohol Program would be a valued colleague to those of us in law enforcement, but Jack is, to the extent that he chairs our Criminal Justice Advisory Board. And we understand that what we do and what his group does go hand in hand. We're also very excited to have 2 young people here with us today who are members of the Substance Abuse Prevention Coalition Youth Advisory Board. Did I get that right? Okay, we have Emily Collini, who is from the Cumberland Valley School District, and Jacob Spong, who is going to go to Redland, so that's from the West Shore School District. And we're happy to have them here. Their group is a group of leaders among their peers who participate along with the members of the Substance Abuse Prevention Coalition in trying to get the message out to young people about the dangers that drugs and alcohol can wreak on their lives. And you'll hear from some of these people here shortly. It's my honor now to introduce a man who has been a friend of mine for many, many years, who had a distinguished career in the Philadelphia District Attorney's Office, and for a lot of that time served as the legislative liaison from the Philadelphia DA's office to the Pennsylvania District Attorneys Association and to the legislature. And you might not think that's a big deal. That's a huge deal. We essentially, as DAs, have our own lobbyists in the Capitol, and that was Gary Tennis for many years. Gary retired from the Philadelphia District Attorney's Office and was named the Secretary of the Department of Drug and Alcohol Programs by Governor Corbett. When Gary was serving as legislative liaison, he was a leader actually in proposing and emphasizing treatment for offenders. And Gary was smart on crime before the term smart on crime existed, I think, and certainly educated a couple generations of DAs on the importance of treatment. And you've always heard me say it's important to lock up the offenders and treat the addicts. And I learned that lesson very early on in my career from Gary Tennis. Gary's a valued partner for us. He's been a significant driver in this program, placing these boxes around the state. And we're to the tune of, I think, 250 boxes out there now, Gary?
About 200 that are up.
Yeah, and 250 ordered, I think. So without further ado, I'll call on my friend Gary Tennis.
Thanks, Dave. Thank you, Emily and Jacob, for the work you're doing. You're actually saving lives. You really are. You couldn't be doing more for this. I want to thank you starting out. I also want to thank Dave Freed. Actually, this program that is statewide, he was part of the process. He actually played an integral role in deciding to go ahead with this. I remember talking at the Christmas party at the DA's about it, and I said, what do you think? And Dave gave it a thumbs up. He was president of the DA's Association. He's been a leader in the DA's Association for many years, and I just want you to know, you don't know in your own county the role that a district attorney plays among his colleagues, but Dave is truly a great leader of the District Attorneys Association. I've been involved with that group for since 1986, more than 26 years, a long time. and he is really one of the outstanding leaders. So I want to thank you, and I want to thank you for, this is going on across the state because, very much in part because of your leadership. So you're not one to blow your own horn, but I'll do it for you if that's okay.
That's fine.
I want to thank our police chiefs too for the life-saving work that you do every day, protecting our citizens, and the courage and commitment and passion that you have in what you do. So thank you very much, and the county commissioners for being here. And you also have a leader among our county drug and alcohol directors here with Jack Carroll. This is an extremely important effort that we're doing here. Drug overdoses have quadrupled over the past 10 or 15 years as a result of prescribing practices. 4 out of 5 people that are abusing heroin started with prescription drugs. Now, I want you to put these different numbers together. 70 to 80% of the people that we're arresting have untreated addiction. So it all relates together. There's a reason why you're seeing this connection between returning prescription drugs and all these badges up here. There's a reason, there's a total connection. So for those citizens of Cumberland County, what I want to say is there may have been a time in the past when it might have made sense to keep those prescription drugs in your medicine cabinets for a bad day when you got hurt and you didn't want to have to go to the emergency room. But if you do that today, you're putting our young people's lives at risk. Because I'm telling you, there's no question that many prescription drugs that are being abused, are being stolen from medicine cabinets. So you may know that your kids or your grandkids are not going to steal from you. But what about when their friends are over with them visiting, and one of them needs to go up and use the bathroom? Well, do you know? Are they safe? It no longer makes sense. So now, today, there are certain things that are part of being a responsible citizen. Voting, obeying the law, paying your taxes, all those things. But right now, a new thing is added to the list, and that is you need to take good care and make sure your prescription, particularly the opioids and the benzodiazepines, don't get diverted. And you now have really one of the greatest opportunities. I'd say per capita, you probably have more of these boxes now than any county in the state. So I really, really hope you use that. This is a big fight, and as your district attorney has said, there is a connection between drug and alcohol treatment and doing that well in crime. We have a program, a treatment diversion program that reduces recidivism dramatically. People who otherwise would almost certainly have gone around and around through the county jail system are now, when they get diverted to treatment and it gets done right, like it does here, the recidivism rate is 16%. We basically can jam a wedge into the revolving door of the criminal justice system if we do treatment right, and we know that treatment is severely underfunded. We have enough treatment resources to pay for 1 out of 8 people. It's one of the reasons that carefully spending our tax dollars is so important. So it's one of the reasons why with Governor Corbett's pension reform proposal, that's an example of an area where we really need to make sure that problem gets taken care of so that all of our tax dollars are used right. So I know it may seem off topic, but pension reform is a priority. It needs to be taken care of, and it does have an impact on all kinds of government services and our ability to take care of those. So I'm going to stop. I guess the last thing I want to say is, particularly in this county where things get done, everything, I don't know why Cumberland County, everything gets done so well, but it does. Treatment works. For those of you who, your citizens, anybody who might be watching this who either have a problem with prescription opioids themselves or have a loved one, they should reach out for care to Jack Carroll's office, and he'll get you to the right place. Treatment works. If you get the right level of care, it works. You may not think it does when you have the disease of addiction, but it absolutely does. Go get help. We have tens of thousands of Pennsylvanians in recovery from addiction, from opioids and other drugs, and they live long, rich, full, wonderful lives, and that can be yours as well. Thank you.
Thanks, Gary. You know, it occurred to me as I was standing over there and looking at my law enforcement colleagues, I can name you a heroin case out of every one of their jurisdictions. And it was not like that when we all started. And it's like that now, where we used to get marijuana smoking devices and stems and seeds in traffic stops. Now we get needles and spoons and heroin packets. and it continues to be a battle that we fight every day. I neglected to mention one of our true partners in law enforcement who couldn't be here today, who's certainly helping with this program as it relates to the county buildings, was our Sheriff Ron Anderson, who's represented by Sergeant Brian Ward from the Sheriff's Department here, and Sheriff Anderson's another partner in this program who's taken on the responsibility for these boxes in the county buildings, and couldn't be happier to do enough for us. I want to thank also my staff, who I just said, hey, we want to do this press conference out at the Forensic Garage, see what you can do. And they set this up, and again, got county maintenance to help, because we have that kind of group who helps with things. And they set this up, and I think it looks great. So congratulations and thank you to you. As I said a couple moments ago, I don't know that any of these boxes have been rolled out in a press conference with all 3 county commissioners in attendance. And I'm pretty excited about that. And we couldn't do, and certainly Jack's group could not do the work that they do without the support that we get from the commissioners and the Chief Operating Officer Larry Thomas, who's here. And there's 3 of them. I'm going to call on Barb Cross briefly, who's the chairman of the commissioners, to make a few comments. I'm sure you all know them, but I don't want to give anybody short shrift. So Commissioner Jim Hertzler and also Commissioner Gary Eichelberger are here. We're also going to have a demonstration of the use of these boxes when we're finished by Barb, who brought some of her unused prescription drugs. I can always count on Barb, because those 4 or 5 bottles that I have in my kitchen medicine cabinet waiting for me to bring today are still in my kitchen cabinet waiting for me to bring them today. So I'll probably take them down to Camp Bill Box, Chief Hockenberry, and do that. So Barb, would you say a few words, please?
And I went to the medicine cabinet last night, and as Dave had said earlier, you may recall the surgery. Remember the sprained ankle, but then suddenly you are looking at this and somewhat embarrassed by the date that is on the prescription bottle. Do not be embarrassed, and if anything, do not be embarrassed. Bring this forward now with this great program that we have in the county. I kind of recall about the firefighters do, let's change the smoke detectors, twice a year, spring forward, well back. Let's bring these boxes into that same public outreach that says twice a year, go to the medicine cabinet, open it as you're changing the smoke detector. Consider this also. It will save your life, your family, your loved ones, and then have a better, brighter future for the 2 young people that are represented here today. So I will be more than happy to make this.
Hang on to that. We'll do it
All right,
so they get their photos.
There you go.
All right,
Thanks.
I'm going to call now on Chief Dave Spots from Kingsburg Borough Police Department. He's the Vice President of the County Chiefs Association. A great partner with us in law enforcement, like all of these chiefs here are. One of the other things that comes to mind as I look at this group is we've all been working together for a long time. Which we are here. That means Hockenberry's getting old, Chief. That's what that means. So Chief Spots, you can say a couple words, please.
On behalf of all the police chiefs in Cumberland County, we know this is a good day for all the residents of our county. We know it's a good day for the criminal justice system. We know it's a good day for the public health system. We know it's a good day even for the environment, because every pack of pills that gets dumped in here instead of flushed down the toilet means less issues we have in our environment. But days like this don't just happen. Days like this require work and cooperation. On behalf of the Chiefs Association, I'll toot Dave Freed's horn too. Dave Freed has always been a terrific partner of the Chiefs Association law enforcement in this county, looking to leverage opportunities to make us better, not only in our home municipalities, but in the county as a whole. We're blessed not only to have a guy like Dave Freed who takes the lead and leverage all the departments in this county to get this grant so we can get these boxes out there. But also, I know Jack Carroll for a long, long time. All right, not that long. But, Jack realizes these issues are not just a drug and alcohol problem. The commissioners realize that in order to do what's best for the county, that requires cooperation among the municipalities that make up this county. We cooperate on a lot of issues that help our community and our county be better and safer. Dave Freed's been a leader in making that happen for us, not only here, but with a lot of other county teams that go on that are essential to effective operations, not only for the criminal justice system, but for all our home municipalities too. So again, I think this is a really good day for us, and we can't wait to get the box in our department and start collecting drugs. Thank you.
Thanks, Chief. Okay, one more. The young people told me they didn't want to speak. I have them on the program, just joking. But I would like, he's been mentioned numerous times. I would like Jack Carroll to come up and just briefly address you, because I know that our Drug and Alcohol Commission has some plans surrounding these boxes, and there's some great opportunities for outreach here. So Jack, do you mind saying just a couple words? Thank you.
Thanks, Dave. We are very excited to be here. Our agency, the Drug and Alcohol Commission, has worked hand in hand with the Criminal and County Substance Abuse Prevention Coalition for about 5 years now, or longer, in organizing medication take-back events. And we were delighted and thrilled with the idea of coming up with permanent boxes, so we didn't have to focus our energies around just 1 or 2 events a year. And this is just terrific, and I'm overwhelmed by the strong response from our police chiefs and our police departments in making our communities that much safer. The data is staggering. The United States represents less than 5% of the world population, but we consume 80% of the prescription opiate drugs. We consume 99% of the world's supply of Vicodin. Something's really out of whack there. But not going into the complexity of the problem, the one thing that we can do is do our best to reduce the supply of unnecessary opiate painkillers in our community and make our communities and our schools a safer place. Our county has pulled together a work group, and we're looking at the dissemination and placement of these boxes as a terrific first step in trying to continue to increase community awareness of the extent of both the heroin and the prescription painkiller problem, and we're intending to roll out other activities. We're looking forward to partnering with the medical community and promoting training programs for physicians. The Pennsylvania Medical Society, with a lot of input from the Department of Drug and Alcohol Programs, is working on a variety of best practice guidelines for physicians. And we're hoping to do our best to promote them locally with our local physician and medical community. There's a variety of other events that the work group is working on as well, so stay tuned. We'll keep you informed on what those are.
Thanks, Jack. Okay, just a couple more details before we close. The packets, there's some more up here if people would like one, we've handed them out. There's a list of locations attached. It indicates what products are accepted, not accepted. Indicates the program is free and anonymous. There's also the Department of Drug and Alcohol Programs website, has a box locator on it, so once everything's up and running, people will be able to go online and find out where they can go, and I know that information, I believe, will go on our county website as well. So it should be pretty simple to find out where to go. I could make it actually very easy. Any municipality with a municipal department, drop it off in 3 county buildings. And there are some drug abuse facts on the back of that sheet. So I want to thank everybody up here with me for coming. Happy to take any questions, or we can do that offline if you want to do that.
Are any of these boxes, are they going to be or now under video surveillance?
It depends where they go. The boxes, as part of the program, they need to be secure and in a secure location, which generally means in the vicinity of a police department in the municipal building.
I think that there's a DEA regulation that requires it to be under law enforcement, when they're open to the public and to the law enforcement, it's 15.
Right, but that's a great question. The purpose of this program is to be anonymous, and I can tell you as district attorney, we're not looking to use these for any law enforcement purpose. This is about getting drugs off the streets. Anybody else? Okay, thank you.
Can you